financial literacy, and the human condition with the Money Doctor, Dr. Francis Rahaim.
We have Dr. Virgie Bright Ellington. Yes, like Duke Ellington, for those of you who know the musician side of me. And she is an internal medicine physician, a medical expert for billing, and what I would call a fierce patient advocate. After dealing with her own overwhelming medical bills, she's a 2-time cancer patient survivor, if I'm correct about that. She took her insider knowledge of health insurance billing and turned it into a simple 3-step process that anybody can follow to crush their medical debt.
So I woke up after emergency surgery and found out I had this sweet roommate, a young mom who had 2 toddler children who had been told that, you really need to stay and have this workup done. And she says, you know what, I don't think I'm going to stay because last time I was here for a whole week like now, and I got a huge bill. And the day that they said I could leave, somebody from the hospital department came in and said, before you can leave, you have to sign this document that says you agree to pay whatever your insurance doesn't pay.
Yeah, which I think is really common, actually.
It's common, and it's called balanced billing, folks.
Yeah.
Don't fall for it. If you have insurance, don't fall for it. And I tell the story, the curtain dropped and I literally saw red. I was so enraged because I knew she had been deliberately tricked into signing an agreement. If you sign on the line, you owe it, right? And I thought, you know what, Virgie, don't get mad. Don't get angry. Get to getting. Do something. And that's how Crush Medical Debt was born. I want to say 6 months later, I got a bill. I laugh about it. I tell the story. They tried to balance bill me for almost $90,000. Same exact hospital from that visit.
Wow.
And I'm cracking up, I they're trying to balance bill. The author of What Your Doctor Wants You to Know to Crush Medical Debt, really? Oh, this is going to be fun. And they ended up in my book.
Oh, that's great.
That example. If docs knew what was being billed in their name and being, just crushing their patients, human beings, and causing tremendous stress, which causes medical problems, chronic conditions, we would just be out. They would be outraged.
And just to be very clear about this, it may not even be the people sitting at the front desk that you see. It could be a total third-party company.
It's never the person at the front desk that you see. I guarantee you. It gets sent to someone else. There's nothing connected to your bill that you receive and the care that your physician and or the hospital provided for you. They're 2 different languages, 2 different worlds. And that's why you have to have what I call basic medical financial literacy in the United States to protect yourself from getting crushed by medical bills. I say, most of us in the United States, in this country, living in this country, are just one injury or accident or medical problem or chronic illness away from chronic debt, a lifetime of debt, or worse, bankruptcy.
Yep. Yeah. Again, a pattern, I think, for people is feeling shame, feeling pressure, feeling like they want to be a good person. Somebody saved their life. They should just find a way to pay this. So would you describe your 3-step process for us?
Sure. So the first step, like we mentioned, is, opening that bill and making sure, usually it's a snail mail bill that you get. I don't recommend that you go with the bill that, they text you or that kind of thing, which is what they want to do. It sounds very conspiratorial, but I say they because it's a system. As you said, it's a corporation, it's a business, it's an industry.
Yes.
So the best thing to do is to get a snail mail, a real physical hard copy bill, open it. And the first thing you're going to do, step 1, is to make sure that you have what's called CPT codes. CPT codes are to medical services what barcodes are to products in a retail store. So Dr. Francis, let's say that, you have your favorite brand of water, and instead of the 8-ounce size, you're going to get the 16-ounce size. Well, when you scan it, that the barcode registers, hey, this is a 16-ounce of this brand. And so the computer knows on the other end what to charge. Same thing with CPT codes. It's a fancy name for codes, a barcode for medical services. And every medical service you can think of in the United States, any test, procedure, office visit, hospital visit, ER visit has a specific CPT code. So anything that does not have a CPT code is not a real bill. So step one, make sure you have a real bill with CPT codes. If you're not sure, your first step is to call the provider's billing department. Rarely you have to say, look, let's do this. Can I get a quote UB-04 form, unquote. Step two is to take that number, the actual CPT code, and it's really easy. Just go online and put in the CPT code, and up will pop the description of what it represents. And while you're there, also ask, what does Medicare pay for this rate? Or what's a Medicare range or payment range for this code, for this service? In the medical legal system, the legal world, if you're disputing a bill, a fair rate is considered 2 times the Medicare rate. Step three is once you have the right number, you know what the right number is, that you got to go back and negotiate. I mean, I'm going to not use my insurance, I'm going to use cash. And this is a fair payment. Who can I speak with who can help me make a payment plan that fits my budget?
All you're trying to do is get it to be correct, figure out what you really owe, and then use your system to crush it down, and then throw it into our system and speed up the payoff and give it that double whammy. Underwritten by
Hug your money, it's where you belong. Your future's waiting steady and strong. Dignity shines in the smallest stream. Permission granted to chase your dream. Permission granted